Hello, everyone. Welcome. I would just like to welcome you here to this webinar. We're going to wait a couple of more minutes. I know it just started, so we'll wait a couple more minutes. But if you'd like, you can share in the chat box where you're calling in from. All right. It seems like we have someone from Albuquerque, New Mexico.
Desiree, I'm seeing some people saying the chat is disabled.
Oh, okay. We'll get right on that.
I guess in the meantime, people could just put their where they live. Oh, someone's coming through in the chat. Here we go. Thank you.
Wow, we have a wide variety of people from all over the place, which is really great. So we have Austin, Texas, Oklahoma, Oregon, Farmington, New Mexico, another New Mexican, as well as Oregon, Kansas. Wow. All right. We'll give it a couple more minutes and then I'll go ahead and start. I'd just like to welcome everyone here. We're so excited to be having this webinar with you. Yay. Again, if you're just coming in, if you'd like, while we're waiting, you could put down where you're calling in from in the chat box.
Some people still seem to be having trouble with the chat. I don't know how come. Apologies. Wow. All this all over the country. Canada. There's
Got it.
Aaron. Hello, Aaron.
All right, well, we'll just go ahead and jump into this webinar. Hi, everyone. Welcome to Understanding Disabilities and Native Communities webinar. This is an introduction to the toolkit that we just published. And to start things off, I am going to go into the introductions. So I'd like to introduce myself first. My name is Desiree Lapahi. I am the data analyst here at the National Indian Council on Aging. I am a proud member of the Navajo Nation, and I was the main project person for this toolkit. And next, I'd like to introduce Rebecca. Rebecca, if you'd like to introduce yourself.
Yeah, I go by Becky too, and I'm from Cherokee, North Carolina, and I'm Eastern Band Cherokee, and I'm really, really proud of this toolkit and the great job Desiree and Kayla, who's also helping on this, did. So yeah, and is Amy here? I don't see her. So is Kimberly available? Is she here? Well, I don't see her, Desiree, but I guess we should just go on ahead and they can join later.
All right. Yes. So I'd just like to mention that Amy Nicholas from the National Council on Disability helped us because initially the toolkit was NCD's project. And so when we took it over, we were working with Amy. So always grateful to NCD for allowing us to be a part of this project and for us to spearhead it. And then Kimberly Yellowrobe, she was one of our technical experts that we reached out to when we were doing reviews about it. So just to give you a little insight as to why these people are very important to us. And so let's jump in to some housekeeping. So you can ask some questions. If you have questions throughout the webinar, you can go ahead and ask it in the Q&A or in the chat box. If you'd like, if you're feeling up to it, I know there's a lot of people on the call. You can always raise your hand via the emojis. I know there's some emojis, and we will get to your question. All right, and then if you could please mute yourself while the webinar is happening, that would be helpful. And overall, let's get into it. Okay, very excited to show you this webinar. And all right, on to the
Desiree,
next.
can
Yes.
I add one more thing is that we paid for the work to do this project from funding from a grant from the Administration for Community Living and the Administration on Aging.
Oh, that's right. And we also have some poll questions throughout the webinar. We have a pre-evaluation, so if you could please fill that out. We'll give you a couple of minutes. All right. Okay, so we'll go ahead and move on. I don't think there's anything else I'm missing. Becky, Kayla, is there anything?
It looks like the numbers are 37% say that they don't feel very confident about using the toolkit. So yay, you're in the right place. Hopefully by the end, you'll feel much more confident. So thank you everyone for being here. We look forward to a great discussion. Thank you so much.
All right, so we'll get back into it. So initially, Indigenous views on disability. Not every Indigenous language has a word for disability. I mean, there's over 500 different federally recognized tribes, and that's not to include some of the state tribes as well. So while there are different themes throughout these tribes, not every language has a word for disability, or even, stories about people with disabilities, or some tribes may use descriptive languages to describe a person with disability. So there's a lot of variation on just disability within tribes. I did want to share a couple of stories from tribes that do have an entity with a disability. So let me go ahead and share that. Oh, we also have Kimberly Yellowrobe on the call. Kimberly, would you like to introduce yourself for the audience people?
Yeah, Hinhiniwashte. Good morning, everyone. I'm Kimberly Yellowrobe. I'm an enrolled member of the Rosebud Sioux tribe from South Dakota, and very honored to be a part of the NICOA's technical advisory expert panel in revising the toolkit. It's a great toolkit. So good morning, everyone, and apologies for being late. My Zoom didn't work.
Can I just also add about Kimberly, Dr. Yellowrobe, excuse me. Her grandmother was an original member of NICOA back in the day. So yay.
Yes, my grandmother, she helped form the NICOA. She's one of the original board members. And that was back in the early mid 70s. And I actually attended that first conference with them when they all gathered in Albuquerque, New Mexico. So really honored to carry on the legacy of my grandmother working with NICOA and our American Indian folks with disabilities. Wopila.
All right, thank you for that introduction, Kimberly. So we will move on with the presentation. So I wanted to talk about Indigenous views on disability and kind of some of the stories of tribes that do have people with disabilities within their own cultural stories. A couple of them that I did find was a Navajo story. I'm Navajo from the Navajo Reservation. One story that I did find from my own culture was the story of early Dawn Boy. There are a lot of different variations about this story, but the lessons are the same. And so the story goes is that there was a group of Navajo people living together, and they had children with disabilities that they took care of, and they unfortunately were getting tired of taking care of the kids. You know, they couldn't really go anywhere because there wasn't a lot of accessibility. And so the way the story goes is that the village the village of people decided to cast away the kids to another portion of the village. And so during that time there was a boy. He had a leap in his walk, but he had a strong heart and mind. And he was also cast aside with some of the other children with disabilities. They were sent to live on their own. And at the time, White Dawn Boy, that's what his name was, or Early Dawn Boy. I know the story as like White Dawn Boy, so that's what I'll refer to him as. So he was old enough to know that it wasn't right the way these children with disabilities were being treated. And so he would have some of the other kids being carried on his back, and he would take them one by one to the water near the village to make sure that they were bathed, they were fed and cared for. And he had some of the older kids do that as well. And so it became a tribe of kids who would help each other. You know, if there was one person who was physically able to carry another person, they would do that. So they would go to the water and they would be bathed and fed. They found plants like roots and berry to live off of. They made a makeshift house that you see in the picture here, a bat, yeah. And you know, the children got stronger and they began to grow taller and bigger. And while they were at the water, they were visited by holy people, by our Navajo holy people, who told them stories and taught them how to make beautiful clay pots from the mud that was near the lake. And these instruments would be designed for ceremonies, for Navajo ceremonies. And by this time, everyone in the village thought the children wouldn't would be gone. Either they would leave or find something else to do. So the villagers began to spy on the kids' life, and they noticed that every morning they would go to the water. And so one day one of the people followed them and saw how happy they were to go to the water. And one day White Dawn Boy came back to the village and told them that he and the children were going to leave and won't return, and just kind of like scold him on how, you know, you shouldn't have left us like that because now we're going to leave. And after a while, the relatives and the villagers began to miss the kids. And so when they heard that they were leaving, they went back to where the kids were hanging out by the lake. And they found the beautiful pots, the beautiful ceremonial things that were there at the lake that the children had made, but there was no sign of the kids or White Dawn Boy. And so realizing their mistake, these parents cried and cried their kid's name to the four sacred directions, north, south, east, west. And on the other side of the lake, the parents, the relatives saw the children walk along the water and saw the holy people greet them, and they lifted the kids off the earth and they disappeared into the sky to become the holy helpers. But White Boy Dawn stayed behind. And so every dawn he comes to hear the people's prayer that they offer. And I think the story just really goes to show that White Dawn Boy has such love and compassion in his heart. And he just watches people's everyday life and represents life in all different ways, no matter how abled you are. So I think this is a really great story, and to just have compassion for people with disabilities and how unique they can be included into activities. But that was just one story from the Navajo perspective. Again, this may be told in different ways, but the lessons are the same. Another story was from the Hopi Pueblo, which is here in New Mexico or Arizona. And the story talks about a cross-legged Kachina. I apologize if I butcher the name, but I believe it's Huhua. I meant to have my notes with the phonetically correct way to say it, but I misplaced it. So he's a cross-legged Kachina. He has other qualities he brings to the community. He dances, he jokes, he composes songs, he teaches people to be kind and respectful to each other. So it's just noticing, it's just a sense of community, in the sense that if you aren't able to be a dancer or to help with firewood or ceremonies, there are other ways for you to join in. You could either be you could teach the younger kids how to do some of these ceremonies or teach them. So it's just the sense of community that if you're not able to do one thing, you can still help in a different way. And so those are just some of the stories that I've come across on Indigenous views on disability. And again, not all tribes have these stories. Some of them don't, and they don't even have words for disability, but the lessons are the same, to have compassion and to have a sense of inclusion within the community. And so I thought I'd just share that with you to give you an idea of how it varies within tribes. And so when we were talking about putting this toolkit together, we wanted to include all these different views on disability. And so we'll go ahead and move on to the next slide and talk about currently how AIAN communities are. Just a little snapshot. So yes, people with disabilities in Indian country are often underserved. Tribal communities face numerous barriers, including lack of funding, employment opportunities, day programs, staff, transportation. And so these were some of the concerns that were shared in the original version, the 2003 version of it. And unfortunately, they were still applicable today. But some of the statistics that surprised me was that 1 in 3 AIAN adults will have a disability. And that's higher than any other race within the US. So we do have the highest And so I believe that this is something that we need to tackle and just bring awareness to. And so that was our thought process with the toolkit. And to talk, I'll go ahead and talk a little bit more about how we went about updating the toolkit guide. So as I mentioned, the initial toolkit guide was published in 2003. It was originally published from the National Council on Disability. And it was very beautifully put together. The stories that were included in there were very important, and we wanted to keep that same stories. And so from there, once we realized it needed to be updated, we gathered a team of technical experts who were a part of the AIA and Disability Network. And this is where our fabulous Kimberly Yellowrow came in. And we recruited a handful of people and we asked them, what should we include in the toolkit guide? And I think on that first meeting, the meeting either lasted 2 or 3 hours, where it was just a number of people who had experience, who were either an advocate or a person with disabilities living on a reservation. And just the different ideas, the thoughts, the discussions within that meeting was amazing. And from that meeting, we kind of went forward with some of those suggestions. Kimberly, did you want to talk more about being an expert and how, and just like your connection to the disability network?
Yes, thank you. So prior to working with the organization I'm with now, Banner University Health Plans, I worked with the Social Security Administration for about 20 years. And I use the toolkit quite frequently, just almost monthly, because there's so many different topics. It's over 200 pages. So there's a lot of great resources in there. And so when you visit the toolkit, when NICOA announced they were forming a team to help revise the toolkit, my experience with the toolkit was using the disability etiquette portion of it, training non-natives with tribal cultural sensitivity remarks and sharing with them how things differ for us out there in Indian country and disabilities. So the toolkit, 2003 toolkit, if you ever had a chance to take a look at it, you'll see what a great difference, not improvement, but a difference that the new revised toolkit has done, capturing all of the essence of the prior toolkit. Really, really helps move forward the new toolkit, because there's a lot of information in there. And folks commonly cite how it's difficult to find resources, information, just community outreach tools. And this toolkit has all of that in one. So I've been promoting the toolkit as well amongst tribal liaisons, and encouraging others to use the toolkit as a training mechanism. And it has a lot of different cultural essences that are specific to us as American Indians. And I think that for folks that do use the toolkit, consider, adopting it and, creating a train the trainer. I think that's where Desiree's going with it. I don't want to say that, but that's my intention with it, is to fan it out and to get others involved, not just us as natives talking to the choir, but speaking to non-tribal folks that could use a little bit more cultural sensitivity when interacting with our members with disabilities, care providers, and family members. So kudos, NICOA. The toolkit is great. I've read it through a couple times and really enjoy the information that's in there. Thank you, Desiree.
Yeah, of course. Thank you for talking on behalf of the process. So yeah, as Kimberly stated, we still wanted to keep the essence of the original toolkit. And I think, like I stated, stories were a huge portion of the first one. And so going into the second one, we interviewed a handful of the technical experts to ask them about their relationship within the network and how they feel about some of the changes that are happening. We just into more in-depth interviews than we would usually do at meetings. And so throughout the toolkit, you'll see pictures of them and some of their quotes that we've pulled from their interviews throughout the beginning of the chapters. And so Kimberly was actually one of the people that we interviewed. And so you'll see her picture there and some of her quotes in the chapters. And if you'd like to hear those interviews, you can look them up on our YouTube channel, National Indian Council on Aging. It's on YouTube. We have a couple of different interviews on there from different experts. Some of them are a person living with disabilities, they're advocates, and they all have tremendous information about AIA and communities, you know, with the disability network. So that was the process of updating it and how we collaborated with the local community, not the local community, but the disability network within this project. So
Desiree, can I jump in real quick if it?
yeah, of course.
There's a question about where the source is for the prevalence rate of disabilities. And I just wanted to refer people, I think Kayla shared the link for both the toolkit and the videos. And on page 10 of the toolkit, it says that data from the Centers for Disease Control and Prevention found that 30% of American Indian or Alaska Native adults have a disability, the highest rate of disability of any ethnicity. And I also wanted to mention Robin Troop, who helped you with the interviews, is also on the call. Welcome to Robin.
Yes, we'd like to give a shout out to Robin for all her amazing work in the toolkit. Yes, so I am looking at the chat as well.
Oh,
Robin, would you like to say anything to add to?
unmute. I unmuted Robin, I think. Or maybe Kayla has to do it.
Yeah, can you hear me?
Yeah.
Yeah, thank you. It was a really fascinating and rewarding process, and I hope that everyone finds the toolkit useful. I did research and writing, and the interviews were really informative because it showed the personal experience of parents, individuals with disabilities, and the advocates who work so hard to support the population, the people with who live in Indian country and have to navigate long distances and a variety of challenges. So those interviews are really worthwhile. So thank you.
Thank you. Thank you for joining us.
Sure.
And thank you for all your help on the toolkit. So we'll go ahead and discuss more about what the toolkit has to offer. And Kayla just put in the chat the toolkit guide that you can access. So if you're looking, where's the toolkit guide? You know, where can I access it? Kayla put the website link in there as well. So you can go ahead and click on it and just review it. The next couple of slides will be just me talking about the different topics that are talked about in there. Okay, so when we're talking about disabilities, there are a lot of different topics that we could get into. You know, there's accessibility, independent living, education, assistive technology, vocational rehab, employment. So trying to find a couple of different topics to talk about on this webinar was tough. And these are some of the topics that are talked about in the toolkit. I believe for education, we have a whole resource for parents as well as people with disabilities transitioning into college or the workforce. And as far as housing, we have a couple of housing resources for tribal leaders who are interested in finding funding for housing programs. Accessibility, we have resources for finding more information about that. For this webinar, I am going to be focusing on a couple of different topics. One of them will be vocational rehabilitation programs. We We do have tribal VR programs throughout Indian country, unfortunately, not that many. Um, although we do have some resources on if you were interested in funding that program. Rachel, would you like to talk more about the tribal VR programs if you're able to?
Sure. Can you hear me okay?
Yes.
Hi, everyone. My name is Rachel Allen. There are over 90 tribal VR programs in the country at this time that are funded by the Department of Education Rehabilitation Services Administration. And all states have a vocational rehabilitation program, but historically, they aren't reaching tribal communities or they're not, they haven't served the tribal communities in a culturally relevant and culturally appropriate manner. And so over the last several decades, more and more tribal VR programs have been able to be funded. It's a competitive process through the Department of Education, and it's generally a 5-year proposal. We are able to, tribal VR programs are able to provide a lot of the same services that the states provide, but making sure that that cultural component is in there, and there are specific services that the tribal VRs are equipped to provide that the state VR programs wouldn't be able to, such as traditional healing services that may go along with an individual's plan for employment. All programs have the goal of employment in the end, but the way that might look for each person and even from one tribal community to another might look very different. And there are some, there's a list of tribal VR programs that is at the what's called the AverTech website, and that's the Tribal VR Programs Technical Assistance Grant through NAU. And I'll put that link in the chat in a moment. It's in the book. One of the places it's listed is on page 132 in the toolkit. I'm sorry. That's one of the places that it's listed. But if you aren't familiar with if there's a tribal VR program in your area, that's one place to find the contact list for those 90 plus programs. Also, each tribal VR program has different guidelines as far as their service area. Some might serve only their own tribal citizens. Some might serve all federally recognized tribes. The grant is available also to state recognized tribes. And there's just a lot of really great information and partnership that can take place with a tribal VR if you're not already working with one. And there is the opportunity to share cases with state VR and tribal VR. Some are doing that more successfully and more readily than others. It can be a challenge for some of the tribal communities, of course, if they're more remote and maybe there's a lot of turnover with the state VR program or different challenges that they've had, but that is allowable to share those cases. And each tribal VR program might have some policies that, about sharing those cases and such. So it may not be universal, but typically that is something that we try to do to help spread out those dollars more. The state VR programs, they don't have a grant process. They don't really compete the same way the tribal VR programs do, and they're funded at a much higher rate financially. So some of those more expensive VR services that someone might need might be able to be obtained more readily through the state VR in terms of the financial part of it. And also the vendor process that they have set up compared to in some of our tribal communities, not having as many options for vendors. So, but that's just a little brief information about tribal VR. Thank you.
Yeah, of course. Thank you, Rachel, for sharing that plethora of information. I know it's a lot to take in. So those are some of the resources mentioned in the toolkit as well. And then we did mention some of the entrepreneurship programs within some of the tribes because more of the experts were leaning towards entrepreneurship having a viable option rather than go out and finding a job on your own. So those are some programs that are mentioned in there as well. And so we'll go ahead and move on to independent living. Again, these are just tribal centers for independent living that we mentioned in there. There are other resources as well as like what is an independent living center? What do they offer? So we have a couple that we did mention in the toolkit. Assist to Independence, which is in Arizona, and then there's the Cherokee Nation Home Health Service as well. And I also wanted to mention the culturally informed programs. These are some of the examples of what they do. So they have prayers or ceremonies within these programs that they offer to within these tribal programs. Yeah, so we'll go ahead and move on to the next slide. And then we also have a disability etiquette chapter as well. These are just some of the etiquettes that we included in here for the webinar purposes. It goes into greater depth within the toolkit guide. So one of them is just ask before you help, interact with a person as a person first. Don't assume people just need help. Be sensitive about physical contact, avoid touching their wheelchair, scooter, or cane. Their equipment is part of their personal space. And then think before you speak. And we also have some other resources on just how to also be accessible as far as job employment, on tips on how to be inclusive as well. And so those are just some of the topics that we talk about within the toolkit. Again, this is just what I thought would interest people. And Kayla has entered the toolkit guide in the chat. So if you'd like to go ahead and click on it and just look through it. And then Rachel has also added some more information about tribal VR programs in the chat as well. And so we'll go on to the discussion questions as far as like any questions you guys have about the toolkit or the process. So that's what we'll go into next. These were questions based off of like people who have already read it. I'm not too sure if people have had a chance, but we'll go ahead and look into what did you like about the toolkit. Again, you can answer through the chat if you don't feel like talking, or you could just raise your hand and we'll unmute people and just hearing feedback on it, or like I said, any questions that you may have.
Well, I can jump in, Desiree, if that's okay, because
Yeah, of course.
I've always got an opinion. I think the toolkit was really wonderful. And if people, once they get into it, they'll see that the chapters are filled with so much really good, relevant information. Like if you're looking for sports, exercise opportunities, transportation, education, and that was something Dr. Hernandez helped a lot with, right? In those meetings is figuring out how to be an advocate for your child. So this toolkit is for people of all ages that are Native, right? And applies for kids all the way to elders. But to me, the chapter 1 was really like the heart of things, where there's an overview about people living with disabilities, and then the types of disabilities, and again, the percentages of people living with a disability, an overview of all the different laws that are applicable, and then some of the barriers people encounter that are unique for tribal people. And then I think that etiquette chapter is really a key one for people that may not have any experience, like a lot of us did when we started this project, is, what's a good way to go about talking about people living with disabilities. I mean, there's so many issues with language that we need to become more aware of. And so I think those things alone, the chapter on etiquette and the first chapter, are a really good way to start getting grounded. That's my 2 cents.
All right, thank you, Becky. And I just wanted to move back to the chat. I know while I was talking, there were people who had questions. This one's coming from Maximilian. I know that this is for Natives in the US, but you also help the First Nations in Canada as well. Unfortunately, this is just for US natives, per our grant, right, Becky? But we are hoping to expand this toolkit to other parts of the world, or not, maybe not the world, but like other parts of the US. So,
Yeah, I think Indigenous people everywhere, there's got to be a way that perhaps this could be adapted for, you'd need to adjust a lot of things for the laws in Canada. I'm not sure what those are, but I think a lot of the concepts would be similar. And, yeah, it's a tool and a resource that we want people to use, whoever, and yeah, your neighbors. So you want to help out.
yes, so I think we've caught up on within all the questions in the chat. Oh, we have another question from Angela. I'm not able to view this video. It's too big for my screen. You said the recorded version will be on the website after being live. I'd like to rewatch it where I can see the slides. I believe someone else answered that in the chat. Yes, it will be available. We are recording this. And so you will be able to rewatch it. Becky, will the slides be available
We can
afterwards?
post those too as another thing to download. It might be something about that person's, the way they're viewing the webinar. I'm not good at these troubleshooting things, but that's my guess.
Yeah, so we'll go ahead and post the PowerPoint as well. And the
Oh, she's
toolkit.
saying maybe it's her browser. I'm not in Chrome. That could be. It's kind of over my head. I don't know.
So yes, the slides will be available after.
I see Rachel put in something about the University of Montana Rural Institute, which I've heard a lot of good things about, right? A toolkit for tribal VR.
All right. And I understand some people are now just going through the toolkit, but what topic do you think should be included? I think there are a lot of topics that we wanted to go more in depth with, but because it was already such a very condensed toolkit, there were some things that we couldn't include. Some of the new topics that we included were historical trauma. That was one of the topics that we wanted to make sure was included in there, as well as boarding school, the history with the boarding schools. And COVID-19 was also mentioned in there, but I do believe going forward that COVID-19 will still be a issue. And then we have someone else in the chat. The IEP is where most of my families have questions and need assistance with. I'd like to attend these when I can as an advocate. Yeah, so because we only work with older adults, when we were learning more about the educational aspect of IEPs and other topics such as that, it was very eye-opening to us. So we do have a chapter on education on how to be an advocate, on what to expect and what to do when you're going to an IEP meeting as well. Does anyone else have any other thoughts to share, or then
You might want to check with Kimberly or Robin as well.
okay, Robin or Kim, would you like to have add anything else?
Hi,
No,
this is
I just
Kristen.
encourage folks to, take their time going through the toolkit to review it, because there's a lot of great information in there. And with the revisions help to identify some of the programs and services that are not out there anymore. So the toolkit's pretty exemplifying of what those resources are and what the programs look like. So take a look at the toolkit, and there's a lot of generous information in there that your communities and yourselves can benefit from. Thank you, Desiree. Thank you, Naikoa.
And Kimberly,
Hi,
I
this is-
you are in so many organizations to do with Native disability that yeah, just trying to follow you maybe on Facebook might be a good way to figure out what's going on.
I do want to mention, thank you, that NICOA brought together quite a bit of talent from across Indian country and was really fortunate to meet Mr. Hosky Benali, who is recently appointed to the National Council on Disabilities out of the White House. So Mr. Hosky is an NCD council member, and he's out of the Farmington, Arizona Disability Law Center, Arizona American Indian Disability Law Center. And he's actually formed the Intertribal Disability Advocacy Council, and it consists of nine individuals. 7 are American Indians with disabilities. And then Mr. Hosky brought on 2 consultants, myself and Dr. Daryl Joseph out of NAU. So we hosted our first listening sessions yesterday, and we're speaking to challenges, barriers, and access to services that individuals, families, care providers, parents are facing out there, not just in Indian country, but also in urban areas. So I can get that information to Desiree, but the listening sessions, we have 3 more, 6 coming up. The next one would be July 18th, but registration is open. You're welcome to come and join. Actually, we encourage you to come and join, because this is an opportunity for folks that are listening here to share and voice their concerns. And at the end of the listening sessions, we'll be coming together in September. And it's not going to happen overnight in regards to putting this report together, but we're going to put the report together probably by the end of the year, first of the year. It'll be presented to NCD. So we're looking to have more activity around American Indians and disabilities happening out there through events, listening sessions, talking circles. So I'll send that information over to Joy, I don't know, Rebecca or Desiree. And I think we can get that out to you through them, but really do want to encourage you, because what NICOA is doing, what the IDAC is doing is all to benefit the voices out there in Indian countries. So encourage you to read the toolkit and get involved in as many councils, organizations, communities, because a lot of times for us folks, for us tribal folks, you know, there's always planning tables, but sometimes there's not a chair out there for us. So bring your own chair. Whenever you have a planning event, go to the event. Thank you, Desiree and Rebecca, for all your advocacy. It means a lot. It really does. Out here in the field, it means a lot. Thank you.
Desiree, I'm sorry to barge in again, but I wanted, because Kimberly's talking about partnerships. Let me put my camera on. Talking about partnerships and how important those are, working together. And so just because the book's been done and published doesn't mean it's done. It's going to continue to need to get changed and updated. And the wonderful things that Kimberly and all the other technical experts brought means that there's going to need to be changes and updates and revisions, and that our website's going to reflect that. So it'll be kind of, I don't know how they say, a living document. And I know I see Aaron Olson from Idaho, our friend up there in Boise, who's an ally for Indian country in Idaho, the tribes there, building relationships with the Idaho Commission on Aging. And also a wonderful friend, Amy Nicholas, who's with the National Council on Disability, our partner in crime in doing this toolkit, getting permissions and going through all the hoops that we had to jump through to make it happen. You know, there's just so many good people at all levels of tribal, AAAs, all the, you know, centers for independent living, and on and on. There's just so many different people that want to pitch in and do good things together. And the more we work together, the better. So
Yeah, hey Rebecca, this is Amy Nicholas. Thanks for giving me a shout out. I apologize. I've been having
Oh, there you
technical
are.
issues.
Hey,
And I have a very, what is telling me an unstable internet connection. So I'm not going to put on my video for fear that I lose you guys. Kimberly, it was very interesting what you were saying with Hosky. I just spent the last 2 days with him when NCD had their quarterly council meeting here in Washington, D.C. And one of the reports that NCD approved of, or one of the topics that NCD approved of in 2024 for one of our reports, is the basically the looking at what it means or what it is to be disabled and living on tribal lands, and the differences between the services and that are available to people of on tribal lands as opposed to those who are not. So I'm excited to, I need to get back with Hosky. He didn't let me know about the roundtables or the discussions. So I'm I want to get more information on him for that. But looking forward to that information to help further our report next year. So again, I apologize for the late entry, but glad I could finally figure out the hiccups and get on for a few minutes before hopefully I don't get thrown off.
Well, thank you for joining us, Amy. And then does anyone else have anything they'd like to share? Thoughts, comments?
the chat
Hi.
is blowing up.
This is Robin. I'd just like to share that a good way to start with the toolkit is to just go through the table of contents and eyeball the chapter titles and see what interests you. And then to know that each chapter is structured with background information, statistics, but a lot of resources related to the particular chapter topic. So that's sort of a good way to approach the toolkit. Thank you. This has been a really great overview of the toolkit. So thank you for inviting me as well.
Yeah, of course. We always love to hear from you, Robin, as well. Thank you for the tips. Yes, it's the best way to go through the toolkit because it is a lot to soak in. And I would just like to mention to people that it seems like we've come to the end of the webinar, but if you could do the poll that will be pulling up.
And there's a couple of people had their hands raised, just FYI.
Oh, there were?
Yeah. I think we got to
Let's-
finish this first though.
Okay.
Okay.
All right. And I think that's okay. There we go.
So in terms of results, now that they've been to the workshop, 37% feel, what is that? Number 4, more confident, I would guess. That's good. 67 out of 114 took part. Yay. So let me see, there's people here trying to, there's Elena. So let me see how to unmute her. Anybody that knows how to unmute people? Oh, here we go. Maybe. I think I did it. Elena, can you?
Hi, can you hear me?
Yeah.
Oh, thank you. Just a quick question, and I am just now kind of scanning through the toolkit. I wasn't on the listserv. I'm so sorry, and I got this notice yesterday about the training. So if I'm asking a question that might be redundant because it's in the toolkit, please just disregard. But I'm a program specialist for a family resource center in San Diego. We're starting to do more work with Native communities in terms of resource navigation and resource connection. between Native communities that need support accessing things like regional center, other generic services, anything that would kind of supplement what they're already getting from the tribal group. Are there any suggestions, any guidance on how we can amplify our work and become even more of an ally for tribal communities in terms of resource connection and navigation? Connecting with the tribal VR groups, things of that nature. Any guidance on that? Much appreciated. Or if I could read somewhere.
Yes, I'll go ahead and take this question. Hi, Alina. Well, first of all, so happy that you are willing to reach out to tribal communities and make sure that they have the resources that they need. I would say that, just going to the events where just tribal events and make sure that your presence is known there, I think would be a great first step, as well as checking out different organizations, depending on what you're offering, I think would also be great, like reaching out to different tribal offices. If you like, I can put my email in there and you can email me more specifics about it and I can help you navigate the.
Thank you. I appreciate that. We just want, and these are great suggestions. Thank you. These are actually some things that we're working on currently. And I may reach out to you. Thank you for that offer, just so that we can always make sure that we're being culturally appropriate and mindful and sensitive in our approach and how we're having these conversations. Thank you so much.
Yeah, of course, I'll just.
And then I'm gonna try to unmute Anjoli Dixon. Hi.
Hi, I'm Anjali Dixon with National Center for Mobility Management and National Aging and Disability Transportation Center. I really appreciate going over the toolkit. I also was wondering if there were going to be any other developments to the toolkit regarding we focus a lot in our different regions as we're FTA liaisons dealing with some of our communities that are tribal communities and helping them to kind of get started. Whether it's small transportation systems, and there is a lot with the aging populations and the tribes of trying to get them to healthcare and connect the partnerships that outside of the tribal areas. I see Robin's on here, and currently we'll be doing a workshop with one of our tribal mobility managers on this specific topic. So I would love to connect with anyone else who is interested in talking about those partnerships, or maybe doing another kind of like a little more research on that as well, because that seems to be a really, really hot topic.
Wow. If I'm understanding you're in a non-reservation setting and you want to reach out to Native peoples?
So we are one of the TA centers.
Okay.
Is who we represent. And we have, for the moment, we have various regions that we worked with, and some of our communities are Native American communities that I work with directly. And so we have some tribal mobility managers that we work with, and tribal transit managers that are also developing partnerships and that have connected partnerships outside of the tribal areas to help get people to employment or healthcare centers or food banks and things like that.
Great. And it looks like Rachel put something in here about the closest VR program to you. So check that out. Wow. This is a good little learning community, huh, Desiree? There's a lot of smart people on this call. We're just about out of time, but let's not stop talking, okay? I mean, let's carry on in another way. And if any of you would like to help us be on the technical expert panel going forward, we'd love to have you be there.
Yeah, thank you everyone for coming. Hopefully this was enjoyed. I hope you enjoyed the webinar, and yeah, we will talk soon. I did include my email in the group chat if you'd like to reach out, as well as other web links to the toolkit, to the videos, And yeah, so thank you again for attending, and the video will be posted as well as the slides. So if you thought you missed anything, don't worry, there's a recording. And yeah, so thank you all for coming and have a good day.
Thank you.